Good afternoon. Welcome to the daily briefing here at the St. Clair County EMA office. I want to thank each and every one of you who are taking the time to join us today. I know you're like us. We're looking forward to that day when we don't have to do this, and I wish I could tell you when that was going to be, but unfortunately nobody knows that right now. We're joined again today with Sam Bierman from the Health Department. Sam, thanks for coming in on Saturday.
Absolutely. Thanks for having us again today. As we have done in days past, the totals that we will give you will be for St. Clair County residents that have been tested. We are at 560 that have been tested, 78 positive, which is an increase from 9 of yesterday. We do have our first child that has tested positive. He is a male under 10 years old. We have a male in his 50s, a male in his 70s, 2 females in their 30s, 2 females in their 50s, a female in their 60s, and a female in their 70s. We have 343 negative test results with 139 pending and still at 3 deaths. For state totals, we have 53,581 that have been tested, 10,357 that are positive, which is an increase of 1,453 since yesterday, and 243 deaths, which is an increase of 33 since yesterday. And our thoughts and prayers go out to the families of those patients as well as the healthcare workers that have taken care of them. This never gets easier to announce the increase of deaths that we continue to see daily. Now I will turn it over to Chairman Kern for his update.
Thank you, Sam.
Absolutely.
So, we just started April. April 1st was Wednesday. Today's Saturday, the 4th. If you remember, on Wednesday, we had 50 positive cases. We're already up to 78, with many more pending cases. The testing is out there. So we expect these numbers to continue to move northward, to get higher every day. And so that's why it's important and why we keep on urging everyone to pay attention to the stay home guidelines, the hygiene guidelines. We also had our first child today that was diagnosed positive, and that really drives this home that you're not just doing these things for yourself. You're doing this for those that are vulnerable in our community. Children, the elderly, people with immune systems that are compromised. Those are the ones that we really need to make sure are taken care of, and that we do everything we can to make sure those cases don't happen. We've been getting many complaints here on businesses where social distancing is not being practiced. When we get those complaints, and we appreciate you telling us about those retail operations, that's normally what they are. We call the municipalities. The mayors get on it right away, the police chiefs get on it right away, and they've been very helpful. So make sure you tell us if you see places that are not listening to the order, and certainly are not practicing good guidelines to help us keep this spread down. The key is, let's keep the spread low. Let's keep the plane that we're at, where the hospitals can deal with this pandemic. Let's not get this spike that we're all afraid is coming. Let's keep this leveled off so that we can manage this pandemic in the best way possible. John Nowak is here today. John is joining us. He's the operations manager from MedStar Ambulance Company. John, tell us what are the physical and mental impacts you're seeing on paramedics and EMTs?
I will, sir. Thank you for having me on board, Chairman. We are seeing several different types of impacts on our employees, not just the stress level of what we're dealing with in a whole, but also on how to take care of themselves, keeping themselves safe. And probably one of our biggest issues that we have is when the individuals are done with their job with us, going home. So we've had to make some incredible changes on our normal routines that we do during the day. But the stress level is up.
John, I know you're progressive, and you're always looking for the newest, the latest innovation. You were, if you could have been prepared for an event like this, I think MedStar was prepared supply-wise and otherwise. Are you finding that that there are things that you hadn't expected that are coming up, things that you've been able to have to try to improvise on when you pull up to a site?
Yes, I can tell you, and you're right, sir. We practice and train tabletop exercises for all kinds of things, many different events. Never expecting something like this. You know, we talked about it. You even tried to do some planning on it, but never expected that the whole world would be overcome by this virus. There has been some challenges. Of course, you hear it everywhere, is the different types of PPE and making sure you have the right proper PPE. The ever-changing regulations and the guidance from CDC, that's always challenging, because one minute you think that you got the proper masks that you're being able to use and put on all the crew members, and the next minute you find out that, yeah, you probably shouldn't be using that. So, yeah, there has been some challenges here. I can tell you just on one of the big things is normally when you see an ambulance pull up at your residence, you see both individuals coming in, the paramedic and the EMT coming in. A lot of times at this point, you may only see the paramedic literally make the entry into the home, to where the basic is staying at the front door, just keeping his eyes out. And that is due to trying to keep our contact down. We walk into many residents that have, the whole house is full of people. So, we want to try to keep those exposures down. But once we get in there and the paramedic does a quick assessment and we don't feel that there's a threat, then we come in there and try to do our jobs as normally as we would possibly can. With the virus and everything else going on, we do take a step that, if we believe you may be suspected or maybe that you have come in contact or are showing signs and symptoms, symptomatic, that maybe we might ask you to put a mask on and try to get the other family members to just give us the room to just take care of who we are there for, and then move that way. So yeah, there are quite a few things that have approached us and made us change the way we do things.
Have you had an incident yet where someone hesitated to call for an ambulance that really needed an ambulance, but maybe was afraid to call because either they didn't want to be put in the hospital with a COVID patient, maybe that fear, or the fear maybe they thought you were overburdened and they just didn't want to call?
And I'm glad you bring that up, sir, because I personally had that encounter last night with an elderly lady that had fallen 2 or 3 days ago. Of course, I can't get into a whole lot of detail, but this young lady, or elderly lady, had 3 broken ribs, at least 3 broken ribs, and was laying at home suffering in pain. And her reasoning to me was because she did not want to put the burden on us. She knew that everybody was inundated, from the EMS to the hospitals, and trying to explain to her that didn't matter. When somebody hurts themselves, please call 911. We are there for you. We're going to take every precaution that we can to protect you and to protect us. So please don't hesitate to call 911 to get us involved and get you to the hospital where you can get care. And if you have that slight concern that maybe I shouldn't be going into a hospital, that I could be exposed, I'm telling you, just as EMS and all the hospitals around our whole region, they work very hard at making sure that that's not going to happen, that you're not exposed to a patient that they may have in their facility. The regulations on cleaning and disinfecting, I can tell you, have changed a little bit, and it's very stringent right now, and it's being done. So the hospitals are very safe. Our trucks are safe, and our personnel are safe.
About a week ago, we had a medical professional on who said that they thought that most people who had COVID symptoms were actually taking themselves, to the because they would call their healthcare provider and they would say go to the hospital. They were driving themselves or having someone drive them. Is that still the case? A week later, we're seeing the cases rise. Are you seeing more people calling you to get to go to the hospital that are COVID have COVID symptoms?
Yes, we are. And actually, truly, that is a good ideal to maybe, your health department, you're following the rules, you're making them contacts to your physician. Your physician may be passing you off to the health department. But when you get to that stage to where you may be showing some real symptomatic, you're starting to really have that trouble of breathing, there could be some dizziness, could even be, syncopal episodes could happen. So I would suggest if you got to that stage after you make your contact to the health department or your physician and they say you really need to be put in the ER or go visit the ER, you're probably better off letting us take care of you and calling us just so you're not driving. If something happens to you while you're driving, nobody's going to know what's going on, and then we might expose people that way, including your police officers or firefighters that may have to respond to that accident. We don't want that to happen either.
And then you're in touch with the hospital, so they know that someone is coming to the hospital that has certain symptoms.
Correct. That is one thing I would like to say. If nothing else, throughout this whole event, the whole region, the whole Edwardsville Region 4 has come together. We have great huddles. We like to call them huddles in the morning, every morning at 8 o'clock, just to have the time to bring up anything that we may have run across during the day. Yeah, every agency, every hospital gets to participate in that huddle. So the communications has really grown strong, and we do communicate that. And again, kind of back to your question about driving in, yes, the hospitals are notified from the health department or from the doctor's office that this patient's coming in. But again, if there's any chance at all that you might have difficulty getting there, driving yourself there, call us. We are quite capable of coming to get you.
So I think there's somebody you know here that's sitting to my left. Herb Simmons. Herb, you got a question or 20?
John and I could talk. John and I could talk this business all day long. John, thanks for coming in, especially at the short notice. We talked last week, and I wanted to thank you. When we talked last week, I thought it was really a nice gesture on your part and MedStar's part when we were talking about the lack of the PPEs for the law enforcement and firefighters, and we put that word out that if there was a incident where they were on the scene with you, that you were going to be able to help provide the law enforcement and them. So I really appreciate you doing that. So, and I know they did also. Let's talk about call volume a little bit. I know you guys stay busy, but and everybody's supposed to be staying at home. So one would think that if everybody's staying at home, maybe auto accidents were down and things of that sort. But then the other side of that scale, cabin fever sets in. And then you have domestics and things like that. Are you seeing a difference in call volume?
We are seeing a difference in call volume, and again, just like you said, we're dealing with this crazy virus, but we're still people still are sick. People still have heart attacks, still have shortness of breath that have nothing to do with the virus going on. So we still have those types of calls. I can tell you, we have had a couple of strange calls due to probably cabin fever, trying to do stuff with kids, trying to entertain kids, and people not remembering that they've put a few years on and they might be a little older and might not be able to flex like they used to, and try to show the kids how to do some exercising and may have pulled some major muscles. So yeah, there has been. Car accidents and stuff like that, we always have them. You would think, with everybody being told to stay home, that would slow down. It has slightly slowed down, but we are still dealing with them on a daily basis. So,
let's talk a little bit about the 8 o'clock call they do every morning. I know our agency is on there listening to it. I get a briefing every morning on that. You're heavily involved in that with the tracking system. Could you just elaborate a little bit on that, how beneficial that is to that 8 o'clock call and what's going on?
Yes, we have we're very fortunate in the state of Illinois. The state of Illinois decided about 2 years ago to purchase this tracking. It's a great tracking, and I could spend all day talking on it, so I'll try to be brief, but just to give you a good idea, we can track anything, not just patients, but that's truly what it's designed for. We can track patients from the resident to the hospital, from the hospital to a nursing home or to some other alternate care. It is very vital. It's real time. It's a website. You know, all the technologies that we have nowadays. It's an alert system to let the hospital know that somebody in the field, the paramedic, might suspect something of this patient, and he can send that alert to the hospital very quickly, and only that hospital receives it. It's a very HIPAA compliant system, but it can track sheltering if we set up shelters. It can track everything. MedStar has been very fortunate to be a part of it. East-West Gateway, the STARS organization from Missouri that includes Southern Illinois, 3 counties from the state of Illinois. They purchased this system a few years back, and we were lucky to be a part of it, and we have found a lot of benefits with it. So we've been using it for a long time. But yes, it is very important because it's real-time information coming from the field without even making the radio call to the hospital to let them know that you're inbound with the patient.
So it's a good tool in this type of situation that helps out, so that's really good. And I know you've really been active in getting that perfected, so we appreciate that also. Let's talk a little bit about the difference of the calls. For the person that's sitting at home, when they call 911, they're expecting that ambulance to show up, and they're expecting you to basically be the doctor. But there are those controlled environments at the nursing homes and from hospital to hospital. Your staff kind of prepares. It used to be able to prepare for those type, because when you get that call from that nursing home, you're getting all the information of what you got. But when these people are calling you from their homes, that's when they're taking those extra precautions, at least back then. But now you're treating everybody the same way. Is that correct?
That's truly correct. You can expect from at least the MedStar agency at this point to try to protect our crews. We have gone to a policy of at least having your N95 and your eye protection on. We might not gown up unless we have more indicators stating that we need to gown up, but you can pretty much bet on, if you see us getting out of the ambulance, walking up to your resident, that we are going to have at least the bare minimum, the mask and the eye protection on, for 2 reasons. It goes vice versa, or both back and forth, to protect you from us, and then also to protect us from you. So
one of the things on the call this morning, there's going to be some new procedures as far as which hospitals are going to be accepting certain types of patients, and that's going to be information that your crews will have if they present themselves at a residence. They're going to know ahead of time. So we want to let the viewers know that the hospitals here in St. Clair County especially are prepared. And wouldn't you say, is that a fair assessment? I mean, you guys are meeting every day. So tomorrow is going to be the start of different patients being allowed to go to certain hospitals. Am I correct?
Yes, sir. And what you're referring to is we are between our 2 big hospitals in our area that serve us in our communities, St. Elizabeth's and Memorial. They're fortunate enough to be pretty good sized facilities, and then they have some smaller facilities that are in the outlying areas. So what we are trying to do, or what they have done, and this is a great idea, it's great planning. It's looking for that med surge for when this really hits us. Like Memorial, they've made the decision. They've got the beautiful new site, the Memorial East site out in Shiloh. They're going to try to do is to try to take all the OB patients, your pregnant ladies, out to that facility, leaving them away from the Memorial, the big campus, where they're going to try to make that more of a covert collection point. Same way with St. E's. They have a few other locations that are in some of our outer lying areas, and they're just going to try to maintain those two facilities as being the main hub or collection point, as we would like to call, for those types of patients.
Well, good. And John, I know you said you watch these daily briefings that we do here, and you said you found them to be very beneficial. And I know you know a lot of people. You've been out there for years. So for the viewers who follow us for our updates, if you had to tell them one thing, we've preached stay home, personal hygiene, social distancing. In your profession and your expert opinion, what would you want to say to them?
I would have to say the same thing that they keep hearing every day from you folks. And a wonderful job. I'm going to take just a couple seconds here to thank you guys. It is very important that you listen to these gentlemen and everybody that they have brought in to talk to you about the importance of this. This virus is real. It is killing people. As you can see from the reports today, we are losing people. One of the ways to slow that down is to keep that social distancing and making sure that you clean yourself and keep yourself clean, and you protect your family. You teach your kids. I mean, we always teach our kids about washing their hands, but we teach our whole family, our kids, that every time you touch something, you probably ought to, especially outside of your home, you need to protect yourself and wash your hands, either with good warm soap and water or, your alcohol-based hand sanitizers. But that is so important that we take care of ourselves, and then, help take care of each other. Make sure that that's being done. If you don't see somebody doing it, kind of reach out to them. Tell them they need to do that. Every time you walk through a store, you're taking the chance of picking up those air droplets. You don't even realize it, and that's what's going to. And apparently that's how a lot of these folks are now being susceptible to this disease. Is it's not from being with them or traveling. It's because you've picked it up off some type of surface and you didn't wash your hands before you touched your face. So that is the most important thing. It's one of the big things that we drive at our employees about, the continuously, constantly wash your hands, keep your hands clean.
Well, good. I appreciate that, John. That's all I have. Sorry it took so long, Mr.
Thank
Chairman.
No,
Thank you,
that's
gentlemen.
great.
Thank you.
Thanks, John, very much. John is the operations manager for MedStar Ambulance Company, and we appreciate you coming in today.
Thank you, gentlemen.
Thank you.
Herb?
Well, yes, again, that's another informational that we wanted to let you hear from the boots on the ground. And John has got many years of experience in the EMS business, and I want to thank Deb Kelly and Chuck and the whole crew at MedStar Ambulance Service for letting us bring him in here today and answer some of those questions. I know a lot of the followers will follow up with some questions. A few things, as we heard us talk about the 8 o'clock call we do every morning with the hospitals, and we participate in that. We did get some packets of hand sanitizer delivered today from IEMA. We'll be making sure our first responders have plenty of that on hand. It's the individual packets. I think it's going to work out good for them. You've heard us talking about social distancing. And we're going to continue to beat you over the head of that. If you get tired of hearing it, put a set of earplugs in. That'll tell me that you're hearing it. For those of you who aren't listening, about staying at home, you heard Chairman Kern say we've been getting numerous calls of businesses that are violating the executive order of the governor, and we are forwarding them on to all of the municipalities, all the local police departments, because we owe that to you who are taking the time to bring that to our attention, and we'll continue to do that. As I said yesterday, we're all in this together. We can all be a part of helping stop it, or for those of you who aren't going to listen to what we're asking you to do, you'll be a bigger part of the problem. So we'll be back here tomorrow. We're going to be doing a question and answering session tomorrow. There will be put up tonight a page to where you can pre-screen your questions, and we'll look at them. Please, let's get some good questions. If you want to know, maybe you missed something throughout the week, we'll do that tomorrow afternoon, as well as we'll have another guest on. So we'll be back in a few moments with our ladies to translate this in our Spanish communities. Thank you very much.